And we're very privileged to have as our next speaker, Dr. Jesús Rodríguez-Baño from Spain. Dr. Jesús Rodríguez-Baño is the past president of the European Society of Clinical Microbiology and Infectious Diseases and associate editor of Clinical Microbiology and Infection. He is also the scientific chair of the Spanish Network for Research in Infectious Disease. Dr. Rodríguez-Baño will present on COVID-19 lessons learned in Spain. Dr. Baño.
Thank you very much, Kevin, for the very kind introduction and for inviting me to participate in very interesting symposium. So as Kevin stated, I will try to summarize the situation in Spain over the last year, some of the activities that have been performed to try to control the spread of the infections and some of the failures or the lessons that we could probably learn. So here you can see the slide that I show in July 2020 when we presented this information in the previous meeting. So here you can see the first wave in Spain. Total number of cases was around 300,000 cases. And then after the full close of the country with a complete lock-in, the situation was controlled at the beginning of the summer that year. Unfortunately, by mid-August, the number of cases started to rise again after the lock-in has been stopped, and the activity has been, during the summer, returned to not normal, but I would say increased from previous situation. And as you can see, we suffered two more important waves and even a third wave more recently. As you can see, the second wave had kind of two cycles, the first one a bit slower than the second. And then the third wave followed probably the meetings during the Christmas season and all the family meetings and all the meetings that usually happen during that time in most of the places. And clearly you can see that the evolution of the pandemic clearly follows the situation in which meetings and movement of people increases. We, as explained, in March 2020, the country was locked down completely for 3 months. But after that, no complete lockdown has been imposed in the country. So most of the measures have been limiting the number of people meeting in inside places, use of masks everywhere, universal masking, even outside and inside. There was some restriction to bars and restaurants opening, which had been changing over the time, and limitation of movements performed in different cities or regions. So this has been changing because the measures from the end of the second wave and the third wave has been undertaken by the regions and not by the local government. The local government tried to agree with the region in some general measurements and some recommendations, but the final decisions were taken by the regional governments. If you look at the number of deaths, this is the number of deaths in the first wave. As you can see, 28,000 of deaths. There was a huge impact during those first 3 months of the pandemic in Spain. And if you look at the number of deaths during the second, third, and even the fourth wave, the number of deaths has been significantly lower than in previous ones. So let me go back and show the full epidemic of cases that you can see here. So you can see that the number of cases in the first wave were approximately 8% of the total number of cases that we have so far. But if you look at the mortality data in the first wave was approximately 35% of the total number of cases so far. So that means, I think there are two explanations for this. First is that the country significantly increased the ability to perform tests. So we diagnosed many more cases during the second, third, and the fourth wave than before. That was absolutely critical to take decisions in infection control and in avoid the further transmission. And second, probably we were able to limit transmission to the highest risk groups. The very high mortality of the pandemic in the first wave in Spain and other countries would be very interesting to analyze in detail. And part of the explanation had to do with the population structure in our country, with a high number of elderly people, but also a high number of elderly people living with some other relatives. And we tend to think that some of the younger relatives infected them through their social contacts. And these were most of the affected people in the first wave, together with elderly people living in nursing homes. So these two aspects were probably controlled in the following waves, meaning that we have a very high number of cases. There was an important transmission, but somehow I would say that the elderly people or those at higher risk of having important complications was somehow more limited. I would not say that it was completely limited, of course. And of course, I think there are many lessons to learn from here. We all think that many of the limitations in the measurement that were undertaken were due to economical reasons more than to health reasons, but this is the effect that we could see. So 35% of the deaths during the first wave, but only 8% of the cases. And of course, the number of diagnoses significantly increased. When you look at a graph like this, as is shown so many times in countries with a high number of cases per million people, so it's incidence measurement, it's important to realize that we are combining here countries which really had a high incidence, like probably is the case in Spain, but also countries which had enough capacity to perform a high number of tests, or in other words, some countries which probably also had higher rates could not show them because they did not have the capacity. This is not probably the case of Singapore, as has been shown before, or China or other countries, but for sure it's the case in other countries. So it's very important that when we look at these graphs, it also reflects the capacity of diagnosing. So really, that was a very important issue in this pandemic. What is the capacity for each country to diagnose the cases and do them in a way that help to control the transmission, or at least to take decisions about how to control the transmission? This is an estimation based on the mathematical modeling. There are many others about the potential evolution of the epidemic in Spain after the vaccination program that I will explain in a minute started. And as you can see here, you can see the second, third, and I would say fourth wave that was much slower than the others, and the situation from today to the future. So you can see in red the worst case scenario that is mostly based on situation in which some of the variant could escape the vaccine protection or previous protection from previous infections. And the darker curve would be the best case scenario. So we might be moving in between both figures, but of course, it's clear that since the vaccine arrived, the situation clearly changed. And this is very important to say because the infection control measures have not significantly changed in the last, I would say, few months compared to what happened after the third wave, meaning that the effect of the vaccine is absolutely clear and absolutely critical for the evolution of the pandemic in our country and probably in others. Kevin and the previous speaker were explaining about the situation of the different variants. Here you can see what is the evolution of some of these variants that for some experts are very worrying, for some other experts are not that worrying. As you can see here, the Alpha variant, which was initially called the UK variant, is now predominant in most Europe and particularly in Spain. Is by far the most frequent variant that we found now, and has been increasing, as you can see, in most continents, but particularly, of course, in the United Kingdom, but other European countries as well. The European curve is the green one in that slide. The Beta variant, as you can see here, is causing a low number of cases in Spain, so it's not very relevant from that perspective as per today. And of course, it's something that could worry or not, but it's lower than 3% now in all Europe at this point. So this is something that should be followed. It's important that we keep on following it, but it's not something that should worry us as per today. The Gamma one is also lower than 5% of the cases, but started to increase recently. And the Delta one also is causing a low number of cases as per today. First cases have been diagnosed recently in our country, and so everybody is just waiting to see what is going to happen. As I said, the worry that this variant is causing is something debatable. I think it's very important to follow them because if any of them really pose any threat to the vaccine's efficacy, it's absolutely critical that we detect that as soon as possible and try to stop it until we develop a new vaccine or a vaccine that is effective against those ones. some colleagues, which are really experts in the immunology of coronavirus, are not that worried because they insist that the probability that this variant escape our immunity or the vaccine response is not that high. But anyway, I think this is critical, and WHO is continuously insisting on that we should keep measuring it, we should keep following them, and have adequate surveillance worldwide to see how these variants are behaving, because otherwise we could be facing big problems in the future. So the vaccination program in Spain started end of December or early January. As in other European countries and in other countries in the world, the decision was to establish the vaccination according to priorities. So the first priority were elderly patients, initially patients over 90 years and then 80 years old, and also at the very same time, healthcare workers. So I would say that most healthcare workers were vaccinated in Spain by end of February, and most of this population, higher than 80 or 90, also were vaccinated by that time. A patient living in long-term care facilities was also prioritized as the first to receive the vaccines. Then second priorities, or priority 2 and priority 3, etc., had 2 criteria. One was the age criteria. So when specific age population was covered by the vaccine, then the next one were to be vaccinated, but also other essential professions like any public health worker, the police, the army, etc. And also all the fragile populations like severe immunosuppressed patients and some other populations, and then progress like that. So that was the priority of the vaccination that has been followed. And an important thing to consider in our country is that the anti-vaccines movement in Spain has never been strong to really challenge vaccination programs in general or COVID-19 vaccination in particular. This is something different to some other European countries in which anti-vaccine movements are more, I would say, are stronger or have been more able to cause some problems here. But fortunately, I must say that that was not a big issue in our country. This is one of the first, or one of the last, surveys that was done by the Imperial College in London, asking people whether they were confident in the vaccines that are being administered against the coronavirus. And you can see that higher than 75% of people in Spain answer yes, and another percent of people say that they were not sure, but will get the vaccines anyway. So it seems that in our country, this situation makes things a little bit easier than in others in which anti-vaccine movements or fake news about vaccines, etc., has been, I would say, more successful. And this is despite some misinformation or some inadequate information that I think that has been the rule everywhere, and also in our country, regarding the adverse event of the vaccines, whether the vaccines have been adequately developed or whether the vaccine has been tested, etc. So despite there was some fake news about that, some uninformed voices saying that the vaccine has not been adequately tested, etc., I think that most people really follow the general recommendations and the government and regional government recommendations about the safety and the adequate studies of the vaccines. In fact, if you use in this slide, this is data coming from our government. This is in Spanish, but I will translate for your understanding. The number, the 33 million number, is the number of doses of vaccines that Spain has received. There was an European Union strategy to buy the vaccines or to have agreements with companies manufacturing the vaccines. All European countries have that agreement, and the number of vaccines received by each country was according to their population, etc. So far, Spain had received 33 million doses, and then the number of administered doses by June 16 was 90% of the doses received. And every single day, we have around 500,000 people vaccinated during the last, I would say, 2 or 3 weeks. So the vaccination, the rhythm of vaccination is really high right now for a country with 48 million people. And the percentage of the population who has already received at least one dose of the vaccines is 41.7%, and 23.2% of the population by June 6 have been fully vaccinated. And this figure is significantly higher as per today, like 9 days later. Which vaccines are being administered in Spain? the fourth that has been approved in Europe. So we have the Pfizer, the Moderna, the AstraZeneca, and Janssen. And according to the number of vaccines that we have been receiving, the most frequent administered one was the Pfizer one, followed by Moderna, and then followed by Janssen, and then AstraZeneca. AstraZeneca has the issue of the development of thrombocytopenic thrombosis, particularly in some young persons and more frequently in women, and that caused a very important impact in the decision about vaccination that I will explain in a minute. So here you can see the proportion of the population that are vaccinated according to their age. In the lower part, you have people over 80 years. All of them have been vaccinated. And again, this is data by June 6. And from 70 to 79, we have 97% of the population, almost 98% with at least one dose, and 94% with 2 doses. And you can see the data for other age groups. And now anyone with any age can ask to be vaccinated. So no longer there is an age limitation for getting the vaccine. So this is the way the vaccination has been evolving. And it has been very much dependent on the number of vaccines that the country has been receiving. So overall, I think that the challenge of administering so many vaccines in a purely public health system, I would say that it's been successful, although of course everyone would have liked that to be even faster. But of course, that was the limited part was the number of vaccines that was being received. And of course, a very important aspect here is, and I would say is a global failure, is the way that the vaccines have been distributed across the world. Once again, those of us who live in developed countries are lucky enough to have much more probabilities of receiving the vaccines earlier than those living in low-income countries or middle-income countries. And probably we are not realizing that if we don't get out of this pandemic altogether, we may have some future problems, of course. And this is, of course, beyond the suffering and the deaths that the virus will still be causing in all those countries in which vaccination is not being that frequent. So sometimes when a friend tells me in Spain or any other Western countries that vaccination is not being fast enough, I show this slide to them, because really this is something that we need to reflect on. One important issue is related to the fact that also in Spain, and I say also because I know this has happened in many other countries, finally, the issue of the control of the pandemic became a political issue. So I would say that during the first wave, it was not like that. Most of the decisions, even some of them could be arguable or we can criticize them. I would say that were not subject of political discussion, but from the second and particularly the third wave, the situation completely changed. There was a strong discussion about whether the economical impact of the limitation of social movements were justified or could be lower, and that caused a very important discussion. So as you can see, the national state of alarm in our country ended in May 9, and there was a very important issue because until that time, some of the limitation in movement could be done because of the state of alarm. So legally, the authorities were able to significantly limit movement or impose movement restriction because of that state of alarm. But once the state of alarm was ended, then there was some limitation in the decisions that the local and regional government could undertake. So they could only limit the number of persons meeting inside a restaurant or the time that bars or restaurants should close or things like that. But some other limitations were not allowed anymore because there was not a legal back for those measures and needed an additional judicial approval to be undertaken. Universal masking has continued in the country from the very beginning, both in and outdoors, which has also been very controversial because while some other measures were not really being undertaken or where bars were open and we were receiving visitors from other countries who just came to our country because our bars were open and the country were closed and young people coming, etc., we have to use masks even being alone in the middle of the countryside. So there was a lot of discussion about that, but still universal masking is in place and probably some decisions about this will be taken in the next few weeks and maybe some changes will happen. As I explained before, the issue of the thrombosis risk with the AstraZeneca vaccine were very important. The European Medicines Agency stated initially that the vaccine was safe, but then put up some numbers in which for the second dose that some people with less than 60 years were waiting for were not that clear. So a trial was started in our country called CombiVac study that performed very fast. And the decision after that was that people waiting for the second AstraZeneca vaccine were to be offered to receive a Pfizer vaccine instead and informed consent in case they would prefer to use AstraZeneca vaccine. And it became political because some political parties said that we should vaccinate people with AstraZeneca because it was the EMA had initially proposed, but some others said that a recommendation of the government to use the Pfizer as second dose should be followed. So it became political as some other issues. This was the press release from the CombiVac study. CombiVac study will be published very soon in Lancet. And what was shown in the study was that by using a second dose of Pfizer vaccine in patients who had received a first dose with AstraZeneca, the level of antibodies, of neutralizing antibodies, was very high, even higher than in historical cohorts of patients receiving the 2 doses of the AstraZeneca vaccines. And some of this information or this data has been corroborated by later studies performed in other countries. So I think the decision was taken based on this. And of course, a lot of people is getting vaccinated with Pfizer after first dose with AstraZeneca. These are the posters for the political parties in the regional elections in the region of Madrid. And I show it because the winner, which is the lady in the upper right poster, the logo was Libertad, which means freedom. And one of the aspects that they were dealing with was that in Madrid, bars were open more hours than any other place in the country, kind of less strict measures to avoid movements or social contact, etc. So they play something like freedom against measures to control the virus. And there was a huge discussion about that. They were successful and won the election. So you can see how political implications went. So this is my last slide. And at this point, most people in the country have a feeling that the pandemic is finishing. And some of us, we are not so sure. We hope it is, but still some damage to be caused by the pandemic, of course, and some risks ahead. And I would say that one of the things that worries us very much is that political decisions seems to be based on the vaccines as the only relevant measure. Of course, the vaccine is very efficacious. It's obvious and it's fantastic. And it's going very well because the program of vaccination is progressing well and there's high acceptance of vaccine in the population. If something happens with the variants or if something changes, then we will be in trouble. Of course, we still have some contradictory control measures that cause more problems than probably benefits. I would say that the policy for the control of variants is not very clear. One of the most important economical aspects in Spain is tourism, and controlling tourists is not being performed as some of us would like to, probably because of the economical implications of that. And as I said, politics and economics are really taking the leads in some of the decisions instead of purely health care or experts in health. But of course, everyone agrees that there should be a balance between every decision that is being taken. So I think this is more or less a situation that we have been facing during the last year and a half or so, and the situation so far. And we hope we can contribute to other countries with vaccination, which I think it should be a global public health priority right now. Thank you very much.